Hi, Dr. Mark Agresti. I want to talk about this new drug which got approved December 19th of 2019. It should be hitting the pharmacy shelves any day. The drug is called Lumateperone. Its trade name is Caplyta. Before I give the talk, I have no connections to any pharmaceutical company for over 5 years. I don't work for anyone. I don't take any money from anyone. I could say whatever I want. So this is neither for or against this drug. It's just what I can figure out so far. I have no experience with the drug except what I've read. It's not available yet. But what I'm looking at is pretty favorable. I'm looking at a drug which it works differently than anything out there. It works on dopamine, serotonin, and glutamate, which is good. It seems to have a great tolerability profile, which I'm really happy with. It looks like it could be used for schizophrenia. That's what it's indicated for. But I'm thinking down the road it might be used for bipolar and agitation with dementia. And it's got some benefits. Like in the past, like drugs like olanzapine, that was Zyprexa, it put on a lot of weight. It increased cholesterol, triglycerides, insulin resistance, diabetes. It was really bad. And risperidone, that caused elevation of prolactin and caused men to get breasts and women to lactate and to have milk coming out of their breasts. So that was a little weird. And the other drugs like Abilify or aripiprazole and brexpiprazole, Haldol may cause problems with restlessness, can't stop moving, muscle spasms, tics, all sorts of motor problems because of which I'll explain their effects on dopamine. But this drug is unique, and I think people with schizophrenia and bipolar, it's only indicated for schizophrenia, but I'll explain why I think it's very valuable. This drug, unlike the other drugs, has a very low affinity for dopamine, the T2 receptor. And I'll explain in a minute the advantages of that and what makes it still work as an antipsychotic when it really doesn't have a lot of blockade of the D2 receptor, which basic neurochemistry block the T2 receptor in the mesolimbic pathway that treats hallucinations, delusions, disorganized speech and behavior of schizophrenia. But this doesn't do that, so why does it work? Well, the advantages of that, it's very close to placebo in terms of its EPS, extrapyramidal symptoms, the tics, the restlessness, the muscle spasms. So placebo gets 6.3% of EPS effects or muscular effects, where this only gets 6.7%, which is very near placebo. So its EPS effects, its motor effects are really not that bad. And it doesn't really have effects on histaminic receptors like the other ones. That causes drowsiness, dizziness, dry eye, dry mouth. It doesn't really have effects on the anti-muscarinic effects. That would be dry mouth, dilation in your eyes, flushing. Doesn't really have that. And it doesn't have the alpha adrenergic effects. So very low effects at the dopamine, the D2 receptor. It has very low effects at histamine, muscarinic, and alpha adrenergic. Alpha adrenergic side effects would be get up and feel dizzy, orthostatic hypotension. What it did have was, the effects appear to be drowsiness. I think I was looking at 10 to 24% of people had drowsiness. So that would be, I guess you get around that by giving it at night. I haven't given it to anyone, so I'm just wondering. And it really doesn't have that endocrine effects of blocking the D2 receptor in the tubuloinfundibular pathway, which causes prolactin increase. So it doesn't really have that. So if it doesn't block dopamine, how does it treat psychosis? Well, this is where the glutamate comes in. The effects are on the 5-HT2A, the serotonergic 2A receptor, and by blocking that, it modulates glutamine in pathways downstream from the D2 receptors, and through that modulation of the glutamate receptors, it affects dopamine receptors by blocking them in the ventral tegmental area. That's all complicated by saying through the blockade of the serotonin receptor, it has effects on D2 receptors downstream through the modulations of the glutamate receptors. And that's really good. And that's why I think this could be really good in people with Alzheimer's, because what it does is it doesn't affect those D2 receptors postsynaptically. It affects them downstream in other areas of the brain where you won't have a lot of the extrapyramidal side effects. There's a drug, pimavanserin, Nuplazid, that has very low D2 activity, and it's used in Parkinson's, and it doesn't have a lot of extrapyramidal side effects because it modulates the D2 receptors through glutamate, just like Lumateperone. Another quality of this drug, it does block the transporter pump of serotonin. So that's good. So that means it probably has some antidepressant effects. It has other serotonergic effects, which make it also a good antidepressant. That's why I think it'll work well in bipolar disorder, because it'll have a lot of antidepressant effects. This drug, because of this unique mechanism of action affecting dopamine, serotonin, glutamate, make it a very good antipsychotic. It's not going to cause weight gain. It's not going to cause all those pesky tics, spasms, restlessness associated with the other older drugs like Haldol and the newer drugs like Brexpiprazole, aripiprazole. I mean, you'd give it to people, especially young people who are muscular or older white women. They become very restless and get tics, and you can't give it to them. So we lose a lot of those side effects and the dizziness with the orthostasis. You get up and feel dizzy. You lose those side effects. So it may be good for a lot of people, young people, older people, without all the neuromuscular effects, without the weight gain. It's given 42 milligrams a day, doesn't require titration. The 42 milligrams you give at night with food, because it does cause drowsiness. It can cause a little dry mouth, nausea, dizziness, fatigue, and vomiting. But the big thing seems to be drowsiness, so give it at night. You have to give it with food. It doesn't cause breast enlargement in men or lactation, milk secretion in women. No dizziness when you stand up. Doesn't have all those dry mouth, blurred vision, constipation. But there is some nausea, dizziness, fatigue, vomiting, so that could happen. The drug is broken down by the cytochrome P453A4 system, so any drug which blocks that, you can't give it. So it does affect glutamate, and that other drugs which affect glutamate improve depression. Remember ketamine, Spravato, dextromethorphan is one of those drugs which affects ketamine. It blocks ketamine, that causes like euphoria. Don't try that at home. It also causes delirium. PCP, phenylcyclidine, blocks ketamine. People use that to get high. And methoxetamine, I hope I said that right, methoxetamine, that's how you say it, nitrous oxide, they block ketamine. And all those drugs can cause dissociation, hallucinations, euphoria. So all in all, even though I have no practical experience with this drug, what I looked at, it looks like a good side effect profile. There's another thing I'm concerned about is the sexual dysfunction with this drug may be an issue because it does affect serotonin, so that may become an issue, and it does cause drowsiness, but it doesn't cause emotional blunting, the tics, the EPS, the motor side effects, the prolactin with a breast and enlargement and lactation, milk secretion, dry mouth, blurred vision, constipation, dilation in pupils, and the dizziness. So that all looks good. So it looks like sexual side effects, maybe a little drowsiness, nausea, dry mouth, dizziness, fatigue, and vomiting. The big money shots are drowsiness, little dry mouth. So all in all, I can't wait for this drug to come out to see. I'm not saying it's good or bad. I'm just saying it looks like a good side effect profile. It's not another Me Too drug, and it looks like it may be very useful. And it'll be another drug that I think will eventually find its way. One study said it was helpful in bipolar disorder and in dementia with agitation. Any comments, Dr. Mark Agresti? Let me know. Hope you like this video. Subscribe, comment, like. Appreciate it if you could do one of those. Thank you. Bye.